Hello, my name is Kayla Reed, and I'm currently here in the David G. Carter Science Building, here to interview Dr. Christy Salters-Pedneault to talk about the effects of seasonal affective disorder, or known as SAD. About 10 to 20% of people in America suffer from SAD. This disorder can begin at any age, starting as early as mid-adolescence, and it could increase the effect of other disorders.
As a kid, I was super anxious, and that kind of just developed into mental health concerns. Going into college, I was finally diagnosed with depression and anxiety, and as well as being affected by seasonal affective disorder. That definitely, having both depression, anxiety, and being affected by SAD is a very difficult process to kind of go about fixing.
But what is seasonal affective disorder? How does it begin, and what are the symptoms should we be looking for?
Seasonal affective disorder is actually, it's not different than major depressive disorder. It's a type of presentation of major depressive disorder. So the diagnosis, the most typical diagnosis is actually major depressive disorder with a seasonal pattern. So it's not actually a separate diagnosis. It's sort of this subdiagnosis. Most commonly, when people have seasonal affective disorder, it is characterized by depressed mood that has a pattern that starts in the fall or winter and then typically remits in the spring. And so the symptoms look like depression, significantly low mood on most days for at least 2 weeks, loss of pleasure in activities, sleep disturbances, difficulties with fatigue or energy or motivation, a lot of negative thinking, feelings of worthlessness and hopelessness. It does tend to differ from other types of depression in that people with seasonal affective patterns usually have very, very low energy. They tend to have hypersomnia, so sleeping more than usual. Well, some types of depression are more associated with insomnia. And there tends to be overeating and a particularly craving for carbohydrates that goes along with the seasonal pattern. It can appear across, demographics and age groups. However, the most likely onset for seasonal affective disorder is in young adults. So actually, people of traditional college age are at greater risk of developing depression with this seasonal pattern. I should mention that sometimes people don't only have depression with the seasonal pattern, they can also have elevated mood with a seasonal pattern. And so sometimes people develop this elevated mood that happens usually in the spring or summer. So it's not only depressed mood.
The longer we talked to Dr. SP, the better we understood the disorder, and we were wondering if outside factors were affecting it. Connecticut feels all 4 seasons throughout the year, and with winter being longer as well as more gloomy days, is there a way to escape these feelings?
It just makes you, sort of get into these funks that you can't really get out of. It's hard to explain without knowing it, but it just sort of hinders the way you feel like you can react to the world around you. And suddenly, because it's gray or gloomy, suddenly that's how you are. And there's no real way to understand why your body's doing it to you.
With a growing concern about climate change, how do these abrupt changes in weather affect this disorder? And what else can affect it?
So this is really an area of emerging research. There are some growing fields of eco-psychiatry and eco-psychology that are looking at the relationships between, our environments and mental health, including mood disorders. So we do know that, for example, people depending on your latitude, if you have more access to light, you're less likely to develop this seasonal pattern. But we also know that there are other environmental factors that influence our mood. So, for example, there is emerging research that, as temperature increases, that temperature changes influence our mood. The more that we have extreme weather events, those are stressful, potentially traumatic events that can lead to mood problems. So we know that our mood is very influenced by our environment. And so anything that changes our environment is likely to change how we experience these kinds of mood problems. These are multifactorial, meaning they are caused by lots of different factors. So genetic, neurobiological, biological, environmental, psychological, and social. And so that means that there's a wide variety of things that can be helpful or could be parts of the treatment. And the causes for any one individual might be different than the causes for another individual. And so there's lots of different things that can help. Certainly medications can be helpful. Therapy can be helpful. There can be lifestyle changes that are helpful. In addition to that, when people have this seasonal pattern, that type of depression often responds well to light therapy, where there's these special prescribed lights that people can sit under, usually in the morning, and that can help alleviate some of the symptoms. We do know that for people with this seasonal pattern, partially the causes might be related to circadian rhythms. So those sort of biological 24-hour rhythms that our body goes through. And so anything that can help regulate those rhythms might be helpful in preventing this kind of seasonal depression. So that includes things like taking really good care of your sleep, making sure that you have a consistent pattern of good sleep. It can include things like exercise and making sure that you're being exposed to natural sources of light, especially during winter months. So trying to get outside, being exposed to light, all of that can help regulate those cycles.
Okay. SAD is a very important topic, and it's our job to spread awareness. Thank you, Dr. SP, for educating us on this topic. If you or anyone experiencing or suffering from SAD, don't be afraid to reach out. That's all from me. I'm Kayla Reed with Amelia Jimenez behind the camera, sending it back to the studio.